Hi, I'm Jessica Metzger.
Hi, I'm Megan.
And we're the co-owners of Serendipity Luxury Wellness. We get asked all the time, tons of questions about how toxin treatments work, how we like to approach the treatment. And so we decided to sit down today and go over them with you guys.
Yeah, we want you to be fully comfortable and have all your questions answered so that you're nice and relaxed for your appointment.
Awesome. We hope you enjoy.
So first and foremost, people come in asking, what is Botox in itself? Botox is a brand, more like Nike or Reebok would be a brand for tennis shoes. It's a whole class of medicine that's been termed now. Botox is what people think it is. Here in Texas, we refer to sodas as Coke sometimes also. That's another kind of way of thinking about it. So Botox is its own unique brand, but that class of medication called a neuromodulator helps prevent wrinkles and helps prevent muscle movement in your forehead, in your crow's feet, and right here in your glabella.
Basically, the way it works is we dilute the product using saline and we inject it into muscular tissue, typically around the face. We can also do it in more specialized treatments around more delicate areas to stop movement. The way that the compound interacts with muscular tissue is it prevents the neurons in your brain from telling the muscle to actually move. And that benefits us in aesthetics because when our face moves, it creates wrinkles and those dynamic lines, like when we smile or when we frown, that we don't necessarily want. So toxin and filler is two different classes of product. Like we mentioned earlier, toxin itself is used to stop dynamic line development. So dynamic lines, as we know, come from when your face moves, like smiling or frowning, and toxin helps prevent that movement, which in turn improves the appearance of those lines that form. Filler is what we use for more volume loss. So we go through areas of your face that have lost fat cells or have gravity has affected them to create jowling. We can lift it back up, or overall augmentation such as the lips.
Yeah, so as we age, the natural process is for your face to fall forward and down, and that's where you need volume and stability to help pull it back up, which is what filler would be doing. Botox is going to be helping to prevent the individual movement muscles and lines. So they both go together, but they work very differently. Oftentimes people are worried about whether or not they're going to look natural after they've had their injection. I get all the time, will my partner know that I had this done? And hopefully yes, because they're gonna notice that something's different about you. That's one of my favorite compliments that our clients get is they'll say, you know, someone's been trying to figure out, did I get more sleep? Did I get my hair done? Yeah, they can't quite pinpoint what's different, and it's because you are looking more youthful now. You're not having all of the aging lines that are there. So overall, my goal is that yes, someone would notice, but it's a very subtle change. Especially because it's not an immediate change. Botox takes about 4 days for it to start setting in, and it will continue to settle in over the next 2 weeks.
It's also our goal here at Serendipity to always deliver natural results. So we're not going to immediately resort to the kind of treatment where you're going to have a very frozen face. We want you to be able to make facial expressions. We want to see your natural smile come through because that's what makes us lovable and makes us relatable. And we really believe in that kind of connection here at Serendipity. So we're never going to immediately resort to the very, very over-treated look. Unless, of course, that is what you're going for and you've done it many times. We do it for those clients as well.
As a new client, though, who is introduced to toxin, we definitely like to start with a smaller amount. We can always add more, we can't take away. So less is more when it comes to that initial toxin appointment.
For sure. Okay, so as far as the length of treatment that you can expect with toxin injections, the average that they say on brand is between 3 to 5 months, but truly that depends on several factors, like your age, like your metabolism, like how consistent you are with your treatments. Keeping all of those things in mind, you could last much longer than 5 months. There's even products coming out nowadays that we're excited to launch here at Serendipity soon that can last up to 9 months and even longer. So stay tuned for some of that, but it really does depend on a couple of those factors. Really what you can count on is at least 3 months for sure.
Medications do play a role in this. Heavy exercise can also play a role in it. So, I hate to say it, but it is customized to each person. Everybody is going to respond a little bit differently. But overall, 3 to 5 months is a great expectation.
For sure. I did want to mention, what was that percentage that they told us? It's like 3% of the population.
Doesn't affect at all.
That's right.
Exactly it.
That's
so
right.
3% of people, I'm so glad I'm not one of those 3. I'm sorry if you are, but 3% of the people, toxin will not actually work for them. And they will continue to have the movement, unfortunately. So that is a risk that you have to kind of pay attention to, and I don't know what else to say about it.
Hopefully it's not you.
Right, so we just talked about the length that we can expect for toxin to last. One of the things that we can also get questions about is what can I do to help it last as long as possible? So, really, consistency is one of those things. The more regular you get your toxin over time, it has an additive effect, which I think is really cool. That you might not need as much at those later appointments, or you might notice that it's lasting a little bit longer in between those appointments. The more often that you get it, the longer that you've been getting it, you also have muscle memory, so you aren't going to be needing as much of the toxin. So that's definitely something that you can do to help prevent it from wearing off too soon.
Right. I just want to speak from personal personal experience. When I first started getting injections, I was 22. I had just met Megan and she injected me for the first time. And I think we did about 22 units just in my forehead. I've got a big, broad forehead that goes back. And I was needing to get re-injected about every 3 to 6 months. I did start younger though, so that also helps with the longevity of the product. And now I probably inject maybe 10 units. Obviously, I do it very specifically because I'm obsessed now. But and I only need to do that every 6 to 8 months too. So it really does have an effect when you pay attention to it and start as young as possible as well. So speaking of longevity, we also have to mention prevention, which is a new way of thinking about toxin injections. In the past, what we were doing was always treating lines that were already there, coming from a much more corrective approach. But nowadays, there's a lot that you can do to actually start before you ever see lines, before you ever get major corrective needs. One of those things that we love to approach is your at-home routine. So your skincare is going to be really important. Our worst cases that we see in the office, I would say almost hands down, is either a smoker or somebody who's not wearing their SPF. The sun is not our friend. She only hurts us, I promise. She's beautiful, but next is going to be starting your toxin routine as young as possible, like we mentioned with our previous question, before those lines actually show up. That's when you want to start getting injected, because the turning point is when your dynamic lines, meaning the lines that happen to your face when you move, turn into static lines. And static lines is when they stay there even when your face is at rest. Those guys are what turns our brains into major correction, which means we need to start on lasers or chemical peels or something like that. So much more budget friendly to start younger as well. Yep. And then lastly, like Megan had mentioned a few questions ago, is consistency. So the more you keep up with your treatments over time, especially if we're coming from correction, but prevention as well, those lines are never going to have an opportunity to show up. So you're not going to get the lines, and they're definitely not going to get worse the longer that they're being treated.
Exactly. So during an appointment, if it's your first appointment or even if it's your 51st appointment, we always are going to do an evaluation with you. We want to see what your goals are, what's moving, what is bothering you, if there is anything that's bothering you. We do not take a kind of cookie cutter approach here at Serendipity. We tailor each one of our consultations to what the patient needs at that time. And so we're going to talk about it. And so you'll make all these kind of funny movements. We're going to ask you to lift your eyebrows up. We're going to ask you to frown. We're going to ask you to smile real big so that we can see everything that's happening at your face. And then we're going to have you tell us what's bothering you and what you'd like to focus on. After that, we at Serendipity pride ourselves in trying to keep you as comfortable as possible, so we will apply a topical numbing agent. Usually it's a combination of benzocaine, tetracaine, and lidocaine, and it is just a little cream that we put on there. We let you numb for anywhere between 15 to 25 minutes. And once you're nice and numb, we're going to clean everything up, make sure that we're going to prevent infection, and then we're going to go ahead and go with the injections of the toxin. Toxin itself really is virtually painless. It can feel like a small mosquito bite or a small ant bite. Sometimes there's a little residual whelp like you can get after an ant bite, but that usually resolves within about 20 minutes. And sometimes there's a little bit of bleeding, hopefully not too much, but anytime a needle touches the skin, you always have to be prepared for a little bit of that. Afterwards, you potentially could have a little bit of bruising as well, but it's not very often that you bruise too bad.
There's also preventative measures that you can take to avoid some of the bleeding and bruising. If you're already prone, then, that's one thing, but avoiding taking your aspirin about 2 days before, not consuming caffeine the day of your appointment, because all those things kind of thin the blood and get things moving a little bit more. So if you're prone to bruising, then just keep that in mind as kind of a pre-care instruction.
Arnica also can help too.
Yes, and we do send our clients home with arnica on the skin to prevent as well, because we want you to have the most comfortable experience and not experience really any side effects. Does getting toxin injections hurt? So from personal experience and from a lot of client feedback that we've got, it's not a uncomfortable experience for the most part. Anytime you get a needle poke, there's always going to be a little bit of anxiety there, but we do our best to avoid that. We topically numb the skin. We have nerve distractors, those little devices that we can place to keep your mind off of it. But what you can expect in terms of sensation is similar to an ant bite. Stings for just a second and then it's over, and then you look younger, and that's always great.
So, what are some risks or possible side effects after you have a toxin injection? So the toxin injection itself is a liquid that's going underneath the skin, and so you can sometimes have a very small whelp, kind of like a little mosquito bite. It does go away within about 20 minutes, sometimes sooner than that. Sometimes you can have a little bit of bruising. Hopefully we can mitigate that with arnica gel and not taking aspirin before your appointments. Sometimes people will report having almost a little bit of a heaviness because they're not used to those muscles not moving like they used to. It's all very, very normal and to be expected. If there's something that is an appearance factor that you're not looking for, if you've ever heard of the Spock look, the brow drop, those are all things that are very easy to return back to their normal resting place, and just giving us a call and we can help take care of that for you.
Yes, we do always try to get everyone to schedule a follow-up with us as well, because by then we'll see if we need to do any corrective units. We don't charge for that in office if we need to lift a brow back up or sink it down or whatever it is that you need. Those areas are really easy to correct, for sure.
Yeah, and the other thing is during this time of year, we want to be really important because Texas has a ton of pollen.
All that oak pollen.
Yes. So anytime you have a little bit of a wound to your skin, those pollens can go in there and it can make you itch more or even cause more swelling. So sometimes we suggest, if you are one of those people that suffer from allergies, to take an antihistamine like Claritin or Zyrtec this time of year.
Yeah, and it can also prevent, every now and then some people can report kind of a rash because they've reacted to the pollens in the air or something like that. And that's usually due to the broken skin, not the actual injections themselves. So it really depends on a variety of factors. Again, like Megan said prior, we tailor every one of our appointments to the client's needs at the time. So you're likely to expect a change in your charges or in the cost of the treatment because you may not need as much, or you may want to add more. We may be adding different areas like a lip flip or the corner DAO injections. So I guess as a simple baseline, what you can expect, our average client spends between $300 and $500 per treatment. Again, that can go up or down depending on the areas that you want treated, and that sort of thing.
At Serendipity, we also won't treat every single area all the time. A lot of times clients will come in and say, you know, this month it's really my crows that are bothering me, so we can just focus on that too.
Right. And sometimes, like just a couple weeks ago, we had a client come in that she was about to take her bridal portraits, and she wasn't bothered by anything other than the lines that show up when she smiles really big, because of course she's taking her wedding photos. So, you know, we can correct very specifically that way as well. All right, so that's it for our Q&A today on toxin injections. Thank you so much for joining us. I hope you got some education out of it, and we look forward to seeing you at your appointments. Bye.